Hi fans, hi everyone. You're welcome to today's edition on Nurse Ika show, and I remain your favorite host, Nurse Ika. Yes, so in our last video, some of us contacted me asking me, okay, um, after using the 5 arrows to manage a traumatic patient, after you do the emergency resuscitation you need to do, and if you realize that this patient is stable, is there a need for them to still go to the hospital? So today in this video, I'm going to be answering that questions, and I'm going to be telling you why I'm giving you the answer I will give you. Yes. So if you're just joining in, this is Nes Ika Show, and I am Nes Ika. Yeah, on Nes Ika Show, we bring you health topics, we bring you health tips on how to be the manager and the custodian of your own health. So, yes, looking at the question I was asked in my inbox, my answer to it is yes. No matter the first aid we do to a patient or we do to a victim on the highway, it is essential for these people to still go to the hospital. Why do we go to the hospital even though maybe they've done first aid on us and we've been stabilized? Firstly, that's because in the hospital we have medical personnel, people who have been trained to do this job. So they are better experienced and they are more knowledgeable in things like this, better than many of us on the streets who just had to do something because we found ourselves in that situation. Also, you can trust the quality and the appropriateness of the care that the medical personnel are going to give to you. Of course, they are going to do the same things or similar things to what was done on the field, but then they are doing it in a more specialized way. They are doing it with more knowledge in their head. They have evidence as to why they are doing what they are doing. So this is why you have to take them to the hospital, and you can also be sure that these patients are going to get just the care they require while in the hospital or during the course of their stay in the hospital, whether they are admitted or they are just there temporarily to be monitored. And then you can trust that health personnel will be readily available. In most health facilities, you find health personnel 24/7. So health personnel will be available 24/7 to take care of these patients in case there is any new development in the course of their treatment or something is wrong. You can be sure that there will be this interdisciplinary care that will be rendered to this patient to make sure that they meet their needs as individuals. So yes, after you do all the resuscitation on the highway, you are able to stabilize this patient and everything. The breathing is normal, airways are clear, circulation is good, there's no disability and everything. Yes, you still have to make sure that these people are transported to the hospital through the right means. You have to make sure that they are transported to the hospital so that they can get appropriate care related to their problems. So thank you so much. I hope that this has cleared most of our doubts about the fact on whether or not patients who are trauma victims should still end up going to the hospital even if they have no physical evidence of being in trauma. Yes, they should go to the hospital. Sometimes in an accident scene, you even find out that people who are healthy, like they have no wounds, no physical wounds, of course, they have no physical trauma that you can see with your normal eyes, but there is a lot happening in there. So it is only in the hospital that they can run these tests, they can do all of these examinations and find out that, oh, maybe we're having an internal bleeding somewhere, and they're able to arrest it and things. So that is why each victim involved in a road traffic accident should go to the hospital so that they can properly be consulted and attended to as need be. Thank you so much. I remain your favorite host, Nes Ika, and I'm going to bring you more on Nes Ika Show. Thank you. Bye bye. I love you.